Welcome. My name is Stephanie Young, and I'm the Senior Vice President of Institutional Advancement and Alumni Affairs. As one of the newest members of the Baylor community, I have been so inspired and overwhelmed by the countless stories of Baylor alumni leading the fight in COVID-19. Whether it's serving on the front line, serving patients, leading innovation in research and vaccine development, or looking for the new cure, thank you. Thank you for your service. Thank you for what you're doing. I am honored to be joined by Dr. James McDeavitt, Senior Vice President and Dean of Clinical Affairs at Baylor. Dr. McDeavitt, since the very beginning of the pandemic, has been leading our Incident Command Center with grace, professionalism, and a little bit of humor along the way with his weekly updates. Thank you for submitting your questions. We look forward to the conversation and are honored to welcome Dr. James McDeavitt.
Hi, I'm Dr. Jim McDeavitt. I am Dean of Clinical Affairs at Baylor and the commander of our Incident Command Center. Greetings to all you alumni. I really appreciate the opportunity to get in front of you, and in large part because what we've tried to do through this global pandemic, through this unprecedented event in our history, is to really do a better than usual job of communicating out to the Baylor community, to our faculty, our learners, our scientists, our entire community, in a very frequent and reliable and transparent way. Because I think the single most fundamental important thing we've done through this crisis is to really have good and effective communication. Yeah, back to school decisions. First of all, I really empathize with anyone. My children are grown, so I empathize with anyone who's having to struggle with that decision and make a choice, because it's a really, really difficult choice. Every school system around the country, I truly believe, every college and university is doing everything they can to do this safely. And they have good and smart people, and they're looking at CDC guidance, and they are really, really trying. Well, look at the university experience. We opened up Notre Dame, UNC Chapel Hill, other universities around the country that literally within days of opening shut back down again because they failed. And again, not because they didn't have smart people working on it. That's going to happen as we open schools. There will be failures. So I think my best advice is wherever your kids are in school, meet with or get information from the people leading the schools. You should have a high degree of comfort that they've thought about it, that they've got a good plan in place, a plan that resonates with you, that seems to be credible. And I think the other thing is to advocate with your public officials. No plan is going to work in an environment where there is a ton of COVID-19 in the community. If the prevalence in the community is very high, there's just no way you're going to control it in schools. So if you're walking into a school and it feels like school as usual, your kid should not be in that school. So that's probably my simplest advice, is to trust your gut. Are they doing a good job at this or not? My thoughts is it is an incredibly bad idea, and for two reasons. One is we've done that experiment, it failed. That was the Sweden model. England also tried this, and Sweden is nowhere close to herd immunity. Tried it, didn't work. So that's a real life experiment. Second just has to do with sort of common sense and math. There are 325 million people in the United States. I'm going to make a series of very, very generous assumptions and make this as a conservative estimate as possible. But there are about 75 million kids less than 18 in the US. Well, let's take them off the table. And that's a false assumption, because kids do get COVID-19 and kids do get sick, but we'll take them off the table for now. That leaves us with 250 million adults in the US. Well, if herd immunity requires that 50% of the population is infected, and again, that's a generous estimate because it may be 60, it may be 70%, but let's say it's 50%. That means that 125 million people would have to be infected with COVID-19. Now let's talk about the mortality rate of COVID-19. It is probably between 0.5 and 1% if you're infected, mortality rate. Again, we'll assume the lowest number, 0.5%. Well, 0.5% of 125 million is 625,000 people. Currently, about 180,000 people nationwide have died. So to pursue a herd immunity strategy, we would have to be accepting the fact that we're going to look at all the people that have died since this whole thing started, and we're going to expect that 3 to 4 times that number of people conservatively are going to die before we reach herd immunity. And to my mind, that's an unacceptable solution when we have better solutions. And our better solutions are mask and distance, because we know we can control this as a bridge strategy and resume some semblance of our normal life until we have a safe and effective vaccine. So that is the right answer. Herd immunity is clearly the wrong answer. The one experience I heard from, I happened to have the privilege of talking to a number of frontline providers, and particularly critical care physicians and hospitalists, and people that are really hardened. I mean, these are people that come to work every day dealing with death and dying. They are not meek. They are not soft. They are experienced professionals. An intensivist told me a story about his worst day, and it was when he was assigned to a brand new unit that had just been designated as an all-COVID unit, and his entire day, which was very long, was being at the bedside of one patient who was crashing, recognizing there was another patient 2 beds down who was also crashing, and he couldn't get away from the one patient to get to the next one, or he couldn't spend enough time with one patient before somebody else was in serious problems. And he said he just went home that night and cried. He felt that it was overwhelming, hopeless, sense of despair, and he just had to let it all out. And when I talked to providers, the words I heard them describe this experience are those: despair, helplessness, anger, frustration, fear are the words that people have used to describe this experience. Well, again, I just want to thank all of you for taking your time to listen to my babblings. This is a great opportunity for us. And frankly, our alumni are something that we have profoundly underleveraged. We're running one of the best schools of medicine in the best health sciences university in the United States. We have fabulous alumni all over the country, frankly, all over the world. And I think we have not necessarily connected with you as well as we could have. So I hope this is not the only time we do this. I hope we have other opportunities to reach out to you, and I hope that you feel like you are connected to and a part of Baylor College of Medicine throughout the rest of your professional careers.